Call the meeting to order. It is now 4:09. Can I get an approval for this afternoon's agenda, please? Judy and Fabio, thank you. Any additions, omissions, questions on the agenda? Okay, seeing none, all in favor of the agenda? Looks like that passes. Okay, good. All right, any conflicts of interest amongst our board members today? Seeing none, we'll have that noted for the minutes as well. And our first item is Dr. Ahmed. Please update us with COVID, please.
Thank you, John. So as you all know, the province has officially declared that we are in the second wave of COVID pandemic. And especially the regions around GTA are reporting a large number of cases every day, close to between 700 to 800 cases every day, with the cases more centered in Toronto, Peel, Ottawa, and now some evidence in York and Hamilton as well. So the cases are increasing in that area. Our area continues to report cases in the single digits, and with the exception of a few days when we reported a large number of cases, one particular day we reported close to 21 cases, which was mainly from the agri-farm sector. We have declared an outbreak in one of the farm that is the outbreak is right now limited to just one of the bunkhouse with almost 20 workers infected, and most of them will be going back to work soon. They are no longer infectious. Other than that, we're seeing more cases in close contacts, which is from a public health containment perspective. Obviously, it's a good sign that they're all close contact. But on the other hand, the number of contacts are continue to be large, which is suggesting that people are still having all those meetings, despite all these restrictions and recommendations with respect to public health. Locally, so far, we are, as I mentioned, mostly we are seeing cases in the single digits now. The province has moved to the testing, which is now based on the appointment now, and so having the symptoms as well, and that is helping to clear some of the backlog, but also testing is more directed to the people who need those testing. In addition, now we have more testing opportunities available through shoppers in our region. At least 3 of the pharmacies are testing the residents of Windsor-Essex if they have no symptoms, but they meet the criteria for testing, which is if they have a close contact with a confirmed case, then they are able to test those individuals. In terms of communication, our team has moved to, as we promised before, to more of an interactive website now. We're using a Power BI base data that we are reporting on our website, and we continue to add different data elements to it that would allow the residents of Windsor-Essex and anyone else an opportunity to look at the data differently or the way they want, and not restricted to just what we report. So that's something that we will continue to build on, and we're trying to add more and more data element as much as we can on our website that would reduce some of these questions that we often received either from the media or from the general public with respect to data. So overall, I guess from the school perspective, the school cases are still in our region are relatively low so far compared to some of the other regions. So we haven't declared any outbreak in this school, and so far we are doing okay. And in that end, we are communicating regularly with our school board partners, and so far things are going fine. So moving forward, we anticipate that we will see some additional cases in our community, and we are continuing to work with risk sectors, especially the farms and the long-term care home, to provide more specific guidance and support to them to prevent any outbreaks or cases in that high risk setting. Other than that, right now we are working with all the cases. We have roughly, I think, 60 or 65 cases active in our region that our team is following up right now. Happy to answer any questions or comments from the board.
Okay, thank you, Dr. Ahmed. Is there any question from our board members tonight for Dr. Ahmed? Okay, I don't see any. Okay, very good. Thank you, sir. Business arising. Any business arising that we need to talk about? Okay, and then we're looking for approval. Approval of the minutes from September 17th. So I'm looking. A chance to look over that. Judy and Reno. Okay. Any issues, questions to that at all? Okay. All in favor of September 17th minutes? Okay. That passes. All right. So moving right along, 7.0, the consent agenda. So there's 4 different items on there. Is there anything we need to speak of specifically on this? Teresa or Dr. Ahmed? I think Reno has a question.
Thank you.
Yeah,
Just
ahead,
looking
Reno.
at, thanks. Looking at the quarterly report and the projections, looking out, any further discussions with the province as far as funding and coverage of overages for the inevitable deficit that we're facing?
So we have submitted the COVID extraordinary expenses to the ministry, and they have responded with a list of questions for us, as they have with many other health units. And so we are in the process of responding to all of their questions, and we'll submit those back. But the initial report did go in, and as I said, they've responded with some more clarification questions.
And if that request is met, will it cover the full deficit in this report, or the projected deficit that we're looking at for the year end?
It is very separate from this, and Lori will be getting into that in committee of the whole, but okay. Hopefully they cover all the COVID expenses, but we have separated out. This is cost shared programming budgets, this one, and the other one is very separate.
Okay, thank you.
Okay, thank you, guys. Anyone else? Any other questions to anything on the consent agenda tonight? Okay, so I just need a motion on the consent agenda then. And that's Ed and Gary. Thank you very much. All in favor of that? Okay, great. That passes. Excellent. Moving right along here. There's no recommendation reports. There's no board correspondence, I believe. Is there any new business at all? Okay, I don't see any new business at all. So we'll move right to board resolution, health resolution, and letters. We have 2 there, one from the Ministry of the Solicitor General and one from the Town of Lakeshore. Do we need to address any of those? Anyone have any comments or concerns about that?
I do.
Judy,
just a question on the letter from the Town of Lakeshore. It said resolution passed. So did we pass that at the last meeting, or are we going to do that? We're going to let businesses know prior to when they're being publicly announced? Just for clarification, so I understand.
Teresa?
So that is our practice, and this was likely in response to an earlier notification where the business wasn't aware prior to the announcement. But our current practice addresses this issue.
Okay, thank you.
Can I do that? I don't know how to raise my hand. I don't have a left hand anymore. So So,
Just do this, Debbie. Seriously, yeah, just do that. Yeah.
but people are raising their hands, and I don't see anybody's hand, so I never know if we're in the midst of you answering someone else. Anyways, okay, raise my hand. Can I just clarify? I'm trying to bring humor on a very gray day. Can I just clarify? The resolution was passed by Lakeshore, not us, correct? Okay,
Correct.
all right. Thank you. We're going to abide by that. Okay, thank you very much. Hand down.
Okay, Ed has a question as well. Go ahead, Ed. I think you're on mute, Ed. Yeah, can someone help Ed out there? He's on mute.
My question on this resolution came in to endorse them, to support them, or just to put a new resolution? That's the question.
Just to receive.
Just to receive them, okay.
Yes,
okay, thank you.
Yes. Good question, Ed. Anyone else with any questions with the items on the resolution or letters? Okay, looking for a motion to receive these items?
Yeah, Mr. Chair, it's Gary. Yes.
Okay, Gary, thank you. And Joe, thank you. All in favor of that? Receiving both those, that carries. Thank you. Okay, and then I believe we are now moving into committee of the whole. So I'll give it a second for our Joe question. Oh yeah, motion to move. Thank you, yeah, Joe. And I'll need a seconder for that. And Reno, thank you. Okay, so I think it takes a minute for us to do this in the technical challenge here. So we'll wait for some direction from staff and then we can continue.